Hey everybody, it's Dr. Kevin Mao, physical therapist and owner of Balance and Better Restoration. And in today's video, I want to share with you 5 underlying root causes of chronic back pain that your doctors might not be telling you about. Now, for context, every single day we work with people who've been struggling with some form of chronic back pain. Some people have been struggling for weeks, some people for months, and some people we see have been struggling on and off with chronic back pain over the course of several years. And these are people who have typically already been through the medical system. These are people who have already seen their doctors on sometimes multiple occasions. And at the end of the day, these are just people who just feel like they've been completely let down by the medical system just due to the simple fact that they're still in pain despite doing everything the doctors have told them to do. And they are still looking for a solution because of the fact that they feel all of the solutions that have been tried up to this point in the form of taking a bunch of pills or painkillers, sometimes having tried multiple injections, or even people that have already had back surgery that hasn't helped them. And in some cases, they feel their pain is even worse afterwards. So in this video, I want to share with you why this is so common and why, after all the advancements that we've made in terms of, science and technology and medical research, that there are more people who are struggling with chronic back pain than ever before. From there, I'll share with you 5 alternative reasons or explanations that could actually be describing your pain in a much more accurate way than doctors are currently diagnosing you with in their clinic. And from there, I'll share with you ways to be able to self-assess to see if these are the problems that you may actually have. And then from there, I'll share with you some strategies to try to help you fix some of these issues on your own, or to help direct you down towards finding the correct medical provider once we've been able to help you understand some of these problems. Now, there are several problems with the current medical system in terms of how I believe they currently treat the patients who are struggling with chronic back pain, but there are just a couple of problems that I want to highlight because I believe that these problems are at the root of why so many people are actually struggling with chronic back pain despite doing everything the doctors had told them to do. And I would say that the biggest problem I have is just due to the fact that most doctors nowadays only seem to prioritize giving symptom relief or only just treating symptoms without doing any form of investigation as to what is actually causing the person's pain and what is actually causing the underlying problem. So, for example, it's very common nowadays for when somebody actually goes to see their doctor with some form of chronic back pain that they're just be given whatever medication that seems to match whatever symptom they have. So, if they have some form of pain or inflammation, they'll be given a painkiller or an anti-inflammatory. If they have some form of muscle pain or muscle tightness, they'll be given a muscle relaxant. Or if they have something more severe, such as nerve pain that either shoots into the hip or down into the leg, they'll just be given some form of a nerve blocking agent. And that's pretty much it. The doctors nowadays, they barely spend more than 5 or 10 minutes with their patients. Again, there's no critical thinking, there's no assessment, there's no analysis to see what the underlying cause of the problem actually is. Never mind the side effects of taking these medications, especially long term. The fact that a lot of these medications can be harmful to your internal organ systems, such as your kidneys or your liver. The fact that they can be addicting and is the singular cause of this giant opioid epidemic that's been plaguing our society for decades now. Or just the simple fact that a lot of times these pills or these medications will just simply mask or camouflage the person's actual symptoms. So, for example, if the person can't actually feel what they're doing throughout the course of the day that's causing stress or causing strain in their back, but the fact that they couldn't even feel what was happening just puts them in a much more situation than they were even before taking these medications in the first place. And the thing that honestly frustrates me the most about all of this is the fact that it's the doctors that are the ones that are supposed to be telling you about all of this. It's the doctors that are the one that should be educating you about the harmful side effects of taking these pills, especially if you have to take them long term. It's the doctors that are the one that are supposed to understand all of the complex systems within the body, and that pain is something that is very complex. And they're the ones that have the education that are supposed to be able to help problem solve through these things, and that they should understand this concept of treating the root cause of the problem instead of just throwing a bunch of pills that just mask the symptoms. But the truth of the matter is, with today's medical system and how it's currently set up, I don't really see this changing anytime soon. But I believe that this just kind of, rushing to give people, symptom solutions without actually figuring out what the underlying causes actually is one of the biggest reasons as to why so many people are actually struggling with chronic back pain. And one of the reasons why I created this video, so that you can understand that there are more solutions that are out there if we can just understand what the underlying problems actually are. Now, the second main criticism I would have is that when somebody actually does get a further workup from someone like a spine specialist or from someone like an orthopedic surgeon, people that we would consider to be at the top of the field in terms of knowledge of the anatomy or the physiology of the back and of the spine, is that what most people don't realize is that when these doctors actually try to treat you or diagnose your condition, that they're only going to see back pain from a very narrow lens or from a very narrow scope through what I would call a structural point of view or a structural lens, meaning that they're going to make all medical decisions based off of what you need for your back pain, based solely off of what is seen on your x-ray or based what is seen on your MRI alone. And there are absolutely situations in which this is the case. So if your x-ray or MRI reveals some type of a spinal fracture, so if you were in like a bad fall, if you're in a car accident and find that you have a broken back, or if your scan showed that you have some form of bone cancer, or if it just shows that you have such a giant, just kind of bulging disc that's kind of like sitting right on your nerve root that's causing excruciating pain, numbness, and weakness down your leg. These are all situations in which there probably is a structural spine problem that does need to be dealt with in the form of some form of operation or some form of surgery. However, the truth of the matter is that the amount of people that actually have these types of structural problems is actually way smaller than the amount of people who are actually diagnosed with these issues. For example, it's very common for someone to go to see the doctor with some form of chronic back pain, that they're told that they have some form of, arthritis or degenerative disc disease, or that they're told that their kind of medium to moderate size disc herniation must be the cause of their pain and the symptoms. However, we know that this isn't true just due to the fact that there have been so many studies that have been published over the past couple of decades that actually demonstrate that there are millions of healthy people each day, people that have no back pain, people that have no symptoms at all, that when you give these people an x-ray or MRI, that their scans might actually show some form of degenerative disc disease or some form of disc herniation, yet they have no pain and they have no symptoms. So that means that we can't automatically assume that based off what your x-ray says, that that must be what's causing your pain and what's causing your symptoms. And the reason why this is so important is due to the fact that when people are diagnosed with these structural problems, is that sometimes they go down a pathway of actually having a structural solution for their actual issue. So for example, it's very common for someone, especially as they're getting a little older, to go to see their doctor for their back issue, only to be told that their x-ray shows that they have some form of, degenerative disc disease or arthritis, and that there's nothing that can be done. This is something that is irreversible, and the person just needs to live and learn how to accept their pain or risk having some form of back surgery down the line. Or for people that are told that they have some form of medium to moderate sized disc herniation that must be the cause of the pain and must be the cause of the symptoms, and that the only way to correct that is through some form of back surgery to be able to correct or fix that disc problem. However, the problem is for a lot of people is that when they actually have that surgery, so many people end up in a significantly worse scenario than before, due to the fact that they now have to heal and contend with the fact that they had some form of physical trauma on their spine, the fact that the surgery itself probably permanently altered the physiology in the biomechanics of their back as well, and due to the fact that there could have been an underlying issue that was there all along that still hasn't even been dealt with. And these are the things that we're trying to prevent. And this is why, again, I created this video to help you understand that not all problems that are coming from your back are structural in nature, and that not all problems are going to be fixed with some form of, anti-inflammatory or painkiller. And the fact that there are just so many other problems that are out there that could actually be the underlying cause of your pain that your doctors currently just are not having this conversation with you about. Einstein once said that if he had an hour to try to solve the most complex problem or the most complex question in the world, that he would spend 55 minutes thinking about what the problem actually was, and then spending 5 minutes actually trying to figure out what the solution should be. And I feel that in today's medical system, that it is the complete opposite, where people are just kind of just throwing a bunch of solutions, just hoping that one sticks. And again, there's no investigation to what the actual underlying problem actually is. And it's been my experience over the past 13 years is that when we can actually spend some time to actually figure out what the underlying problems actually are, and then actually match the correct solution on top of the right problem, it is possible to see a significant, reduction in your pain and a significant improvement in your mobility and overall quality of life, sometimes within just a matter of weeks. And this is even for people who've been struggling with chronic back pain for years, just because of the fact that we've been able to accurately pin down what the problem actually was. So that's going to be my goal for the rest of this video, is to share with you what some of these underlying problems actually are, and then to help you understand that the reason why you actually might be struggling with chronic back pain is just due to the fact that no one has been able to accurately pin down what your underlying problem actually is. So with that said, now let's get into the first underlying problem that I want to present to you today. Okay, so the first underlying root cause I want to talk about today is something that is extremely common. I think that everybody has probably felt or dealt with one of these things in the past, but it's one of those things that I think that a lot of doctors just seem to ignore or just seem to underestimate in terms of how much these types of problems can actually be the underlying cause of very chronic and debilitating pain. And what I'm referring to is something known as a trigger point. Now, a trigger point is just simply another name for a muscle knot, which is essentially just a little wound up ball of tightness or tension that just kind of lives or sits right in the middle of the muscle. These are typically areas where a lot of chronic stress or a lot of chronic inflammation will start to build up and just kind of create these kind of kinks or just start to create these knots within the muscle, which over time can actually start to limit or restrict the level of flexibility or mobility within the muscle. And it can also start to limit and restrict the level of blood flow and circulation in and out of the muscle as well, which is essentially what could cause deprivation of oxygen into the muscle, which is what could essentially cause the muscle to enter a state where it is chronically achy and chronically tender and tight and painful. Now, I think that everybody has probably felt or experienced one of these types of muscle knots in the past, especially on like a muscle on the top of the shoulder where it can be just, just feel like this ball of tension that just feels like it needs to be like pressed on or massaged or stretched or released out somehow. These are a type of trigger points that we would call an active trigger point, which is something that you are actively feeling. It is consciously painful and it is something that you just feel needs direct attention in terms of, doing some form of treatment just because of how, obnoxious or nagging these types of knots can actually be. But there's another type of trigger point that I feel that most people are not aware of. And I believe that it is this type of trigger point that can actually be the root cause of a lot of people's chronic pain in ways that, again, they just are not aware. And this is something that we would refer to as a latent trigger point. So a latent trigger point essentially has all of the characteristics of an active trigger point to the point where it will start to, create a ball of tension within the muscle, which will limit the flexibility of the muscle and also potentially restrict the blood flow and oxygen into the muscle as well. But the difference between a latent trigger point and an active trigger point is the fact that most people don't even feel these trigger points, which means that most people don't even know that they're even there. And the problem with these trigger points is that when they're unaddressed, is that they'll just continuously cause problems within your muscular system. But most people, again, they don't feel that they're there, so they don't do any form of therapy or release or stretching to relieve pain in these trigger points. And another interesting characteristic about these trigger points is the fact that they can actually create a phenomenon known as referred pain syndrome, meaning that when some of these trigger points are actually pressed on, they can actually manifest or refer or radiate pain into an area that is completely different from where the muscle actually is. So, for example, one of the most common trigger points that we see here in the clinic is something known as a quadratus lumborum trigger point. And the quadratus lumborum is essentially a muscle that runs from the side of your spine, attaches all the way down to your pelvis. And when some of these little X marks, like here in the diagram that is shown here, that when some of these little trigger points are actually pressed on, these things can actually manifest or radiate pain all the way into somebody's hip or even down into somebody's sacrum in their sit bone, almost something that feels like something known as sacroiliac or SI joint pain, or even something known as sciatic nerve pain. And why these things can be so misleading is the fact that most people will try to treat or stretch or do form of treatment where they actually feel the referred pain, meaning towards their sit bone or towards their hip, and not even realizing that pain is actually coming from their back itself. And that the only way to actually fix these trigger points is to do some form of release therapy on where these trigger points actually are. Some of the therapies that you could potentially do at home is to use a foam roller or some form of like a dense ball, like a lacrosse ball, or even some like a softball. And that there are a lot of different, therapists and clinicians that can perform, a specific type of massage therapy known as trigger point release therapy, or also something known as acupressure as well. And there are even certain physical therapists and acupuncturists that perform a very specific type of acupuncture known as trigger point dry needling, which are all ways to very quickly release a lot of tension or tightness that is within one of these trigger points, which will not only start to help you restore flexibility within the muscle and also just improve overall, levels of oxygen flow and circulation to the area as well, but can actually relieve pain off of some of these other surrounding areas that you may actually feel and not even knowing is coming from these trigger points. Now, the last point I want to make about these trigger points is that, when they can actually be identified, these things can release and they can be fixed really, really quickly. But left alone and left ignored, they will just continue to persist and cause problems in the background for a long period of time. Now, one of the fastest ways or one of the best ways to know if your pain is actually coming from a trigger point is you can look up this reference here, which is a book known as the Trigger Point Workbook. This is one of the most influential books that I studied over the years And that for a lot of our patients who we've seen with just kind of weird or mysterious pain patterns, when we just kind of pressed on some of these common trigger points that you'll see in this text, and when it actually did radiate pain into an area where a person was actually struggling with chronic pain, when we would then provide the appropriate treatment to be able to release some of these trigger points, a lot of times their pain would just go away within a couple of sessions. So that's how fast these things can actually be fixed once they can actually be identified. And that, I recommend if you feel or suspect your pain could actually be coming from one of these trigger points, look up this book, look up some of the other resources that you might find on the internet, and you can either use a foam roller or the cross ball, or just have someone just kind of press on some of these X marks just to see if the pain does radiate into an area where you may be struggling. Or the fastest way is to try to look up someone that does some form of trigger point release or acupressure or some type of trigger point dry needling, because this is probably the fastest way to be able to identify if you do have a trigger point problem and to actually get it released very, very fast as well. Okay, so the second underlying cause of chronic back pain I want to talk about today is something that is extremely common. We see this type of problem almost every single day here in a clinic. But again, it is something that you're never going to see on an x-ray. You'll never see it on an MRI because it isn't something that you can see, but it is something that you can feel. And what I'm referring to is something known as a muscle imbalance. So a muscle imbalance just simply refers to a particular situation in which there is a group of muscles that is supposed to work together, perform a task, but there is an imbalance between the muscles in terms of certain muscles that are working way harder than others because other muscles just are not doing their job. Very similar to a situation if there is a group of people that is working on a project at work and that there are like 3 people that are slacking off and all the workloads is being placed on that one person. It is that one person that is going to be one that is overworked and overstressed and tired all the time because the other 3 are, again, just kind of slacking off. And that we typically see for people with chronic back pain due to muscle imbalances, that it is typically the muscles of the lower back that are the ones that are overworked and overstressed. And that it is typically the surrounding muscle groups that just are not doing their job that is causing those back muscles to be in a constant state of just kind of overcompensating for everything else that, again, just isn't doing its job. And why this can be misleading for a lot of people is the fact that when they actually feel pain in their back, it's usually going to come from the lower back itself. So that typically means they're going to spend all of their energy and all the resources trying to actually fix where they actually feel the pain. So they'll focus their efforts on doing, stretches for their back. They'll rub creams or ointments on their back. Maybe they'll even try some massage or get some chiropractic adjustments for their back muscles, and not realizing the reason why their back is actually hurting is because of the lack of function of all of the surrounding muscle groups. And common examples of this might be, for instance, someone that has a lot of weakness within their core or abdominal muscles to the point where the muscles of the lower back have to overcompensate to create stability within the spine because the abdominal muscles just aren't helping. Or for people that spend a lot of time sitting, their hips can be imbalanced and very tight or very stiff or very weak. And then this causes the muscles of the lower back, yet again, to have to overcompensate for lack of function of those hips. Or for people that have really poor posture or have a lot of stiffness within their upper back or their shoulders, the muscles of the lower back, yet again, have to overcompensate for the lack of function of the muscles of the mid to upper back, which just leaves the lower back in a constant state of being overstressed and overworked all the time. And another thing about these muscle imbalances that make them really difficult to diagnose is the fact that there are so many different types of muscle imbalance that exist. It could be because somebody like broke their right foot 9 to 12 months ago, and all of a sudden all of that pressure and all of that stress has now been placed on the left side of their back and their hip over the course of that 9 to 12 months, and only for the person to realize that their left back is hurting, and the person not even realizing that it's coming from the weakness of that right leg. And the only way to actually fix these things is to actually be able to figure out what the imbalances of the surrounding groups actually are. And from there, make sure that you then apply the correct strategy in the form of, making sure that you are stretching the right muscles, activating and strengthening the right muscles, make sure that you're doing the appropriate levels of massage or release for the muscles that are overstressed, overworked. And again, there are just so many different combinations of things that you could be doing that I believe that a lot of people can kind of get lost on the rabbit hole of just doing the right exercise, but just for the wrong problems. But the encouraging thing about these muscle imbalances is that when you can actually find the right combination of, stretching the muscles that need to be stretched, or activating or strengthening the muscles that need to be activated or strengthened, and then to make sure that you do them consistently with proper form and proper technique, a lot of times you can just completely eliminate and eradicate pain that has potentially been there for years once you start to just change your body and your mind's perception of the muscles and just start to learn how to rebalance that stress off of the back and start to learn how to redistribute that stress and load across multiple parts of the body. Because if your back can just live with a lot less stress and a lot less tension, because all the other surrounding muscle groups are finally be able to do their job, again, you'll be able to sense just a tremendous amount of relief. But it just takes a little bit of time to actually figure out what you actually need to do to make sure that you are doing the right exercises, make sure that you aren't doing the wrong exercises. Now, for extra resources, I've put a couple links in the description below through some of our other videos where we explore a lot of these other muscle imbalance patterns, so that you can take yourself through various forms of self-assessments. And then from there, we'll show you some ways to be able to correct some of these things on your own with the right corrective exercise and the right corrective strategies. But again, we'd always recommend, the fastest way to actually figure out what you actually need to do is to just get an assessment with a physical therapist or someone that is really skilled in knowing all of the different, muscle anatomy and physiology, and really understand how everything is actually interconnected. Okay, so the third underlying root cause of chronic back pain I want to talk to you about is, again, something that I feel is extremely common. And I would say that this particular problem is the one that most of our patients, I believe, are just completely in the dark about. And most people just haven't even heard of this problem, let alone in terms of what they actually need to do to actually fix it. And what I'm referring to are problems due to inflammation of your fascia. So, fascia, for those of you who don't know, is the connective tissue glue and the substance that just binds your entire bodies together. It's what keeps your skin on top of your muscles. It's what keeps your muscles held together as well. And it also forms an internal spider web like of network of connective tissue, which also holds all of your internal organ systems together as well. And without fascia, our bodies would literally just kind of fall apart at the seams, because it is literally the glue that keeps our bodies held together. Now, as important role as this fascia plays in terms of keeping everything kind of held and bound together, when it is healthy, it is also pliable and flexible enough to be able to allow our bodies to be able to facilitate movement as well. Because if it was too sticky, if it was too tight, then people would have a lot of difficulty moving under all the adhesive structure, all of this kind of sticky structure that the fascia actually has. And this is actually what happens for people when we find that their fascia is very problematic, whether it be due to chronic stress or inflammation, or just a lot of people who are just generally stiffer and tighter than other people. What we typically find sometimes is that it is the fascia that is the problem, because it retains much more of the adhesive and sticky properties instead of allowing for kind of this kind of pliability or movement, and this facilitation of movement through our muscles, through our connective tissues. And the mechanism that really causes this is the fact that there's a fluid known as hyaluronic acid, which kind of serves as a lubricant to be able to allow the fascia and the muscles to be able to glide very smoothly when the person is actually trying to move. But when the fascia, again, does become inflamed, or when it does start to become very, very stressed, what seems to happen is a lot of this hyaluronic acid seems to start to dry up, and then the fascia starts to become very dry and very sticky. And that's what can actually cause a lot of people's mobility restrictions, a lot of their deficits, and also starts to create the formation of some of these myofascial trigger points, which we talked about in the first bullet point of this video. And another very important fact to know about this fascial tissue that I would say that researchers are only starting to become much more aware of over the past couple of years is the fact that it actually has billions upon billions of nerve endings that send direct signals to your brain through the nervous system, which means that the role of fascia isn't just to keep everything kind of stuck and bound together, but it also serves as a very important network of communication that allows your body to be able to communicate through the brain, and also allows the brain to be able to communicate to the body through the fascia as well. And the reason why it's so important to understand this is because of the fact that it could be your fascia that's actually causing your pain and actually generating all of your pain signals. Because most people are going to associate back pain with either some type of a joint problem, whether it be a degenerative disc or some type of, herniated disc, or some type of muscle problem, like we even just talked about in the previous section. But if your fascia is actually what's causing the problem, the reason why it's so important to recognize the difference between all of those, the above, is because the solutions that are designed to be able to fix joint problems or muscle problems aren't going to fix fascia problems. Chiropractic adjustments or injections to your spine or getting back surgery is never going to fix a fascia problem. Even doing a bunch of strengthening exercises to try to strengthen up your back or try to strengthen up your core is never actually going to release problems that are due to inflammation of your fascia. And the only thing that's actually going to fix fascial problems are fascia treatments. For example, there's a very specialized type of massage known as myofascial release, where a practitioner is going to use their hands to be able to stretch, manipulate, and just try to increase the level of circulation and blood flow and create some separation within that tissue. Or a more aggressive form of myofascial release, something known as the Rolfing technique, or some form of skin rolling technique, where a practitioner might use their hands to try to separate that skin and that fascia off the muscle, and try to be able to grind and try to release all those deep adhesions that might be in there. Or one of my personal favorite therapy techniques, which is known as myofascial decompression, compression, which is also known as suction cup therapy, where a practitioner will essentially use a plastic suction cup that will be able to create a negative pressure vacuum, which will essentially lift your skin and your fascia off the muscle. And this will potentially remove a lot of the adhesions or a lot of chronic inflammation that could actually be restricting the mobility within your muscles. And what it also does is it creates a new fresh supply of blood in circulation to the area, just to be able to stimulate healing in an area which has been what we call stagnated, just again because of chronic stress or chronic inflammation or limitations to blood flow and circulation. But the encouraging thing about fascia problems, and the reason why I highlighted these specific techniques, is because of the fact that when fascial problems are identified on patients and when the appropriate treatment is applied to actually address and be able to release some of these adhesions or some of these tightnesses within your fascia, is that this stuff can release really fast. It can release really quickly, and it can sometimes just even take a couple of days or no longer than a couple of weeks to see significant reduction in your pain and a significant restoration of your overall range of motion and mobility, to the point where we've seen people that haven't been able to, for example, bend over and touch their toes in years, and just with a couple of treatments, we've been able to fully restore the range of motion for them to be able to bend forward without any pain, without any restriction. And they're just sometimes blown away with in terms of how mobile and how good they actually feel when some of these adhesions are actually released. And another thing I want you to know about these therapies is the fact that they're very safe. They're very minimal side effects, other than just some soreness or just some achiness, because sometimes it does hurt a little bit to get some of this fascial tissue released. But usually it comes in the form of that kind of good pain that your body knows it kind of needs something to be done to it. So other than just some mild soreness or sometimes just mild bruising from some of that cupping therapy, there are very, very little side effects. And I would say that there are way less side effects compared to taking a bunch of pills or even risking potentially having back surgery for a problem that isn't even the actual issue. Now, what would be my recommendations if you cannot find a provider who does this type of therapy, or what are some things that you can potentially do on your own to try to fix it? Well, this is where a lot of those foam roller techniques can come into play, because sometimes people can use a foam roller, especially along some of their kind of broader based back muscles, just to start to learn how to iron out or start to be able to just kind of massage or break down a lot of the adhesions that build up within this tissue, which can essentially cause these trigger points that we talked about in section one, that could actually be causing restrictions to mobility. I would also recommend that people engage in a regular stretching or mobility program. I would usually recommend some form of a yoga flow type of a program, where again it concentrates on more of a gentler but more of a flow type of movement, but it's still but it's still going to challenge your body, but and not in such a way where it's very aggressive or really putting your body to the limit, especially if you're just starting to get back into it. Fascia generally likes to be stretched. It generally likes movement, very similar to muscle in that regard, where it just, in order for it to be healthy, it needs to be in constant motion. Now, with that said, I would also recommend that people not kind of stay stuck in one posture or one position throughout the course of the day. We see a lot of people who spend a lot of time sitting or have to work at a computer, or people have to drive a lot. And these are typically the people that have the most amount of fascial problems or most amount of fascial restrictions, just because of the fact that they're not moving, just the fact that their muscles and their joints are always kind of stuck in one position all the time. These are usually the things that cause your fascia to really start to stiffen, really start to dry up, and can cause a lot of these trigger points, or cause a lot of these mobility restrictions in ways that can start to, again, restrict circulation to your muscles or restrict mobility and flexibility within your muscles, and just be, again, one of the most common underlying root causes of pain that most people are not familiar with. Okay, so the fourth underlying issue I want to talk about today is the problem that I would say that I'm not an expert in, because as a physical therapist, I'm trained to be able to treat or be able to problem solve physical problems due to strength problems within your muscles, or range of motion, or flexibility, or biomechanical imbalances that we talked about in the first three bullet points. However, this is a problem that I would say that I've personally gone through over the past couple of years, so I have a much more a greater appreciation for how important this problem actually is. And I think that this is probably one of the most common problems that are out there that I think that not enough people are talking about. And what I'm talking about are nutritional problems. So nutritional problems are nothing new, obviously, with the obesity epidemic and the amount of people who are on like diabetes and all this information out there about how important our nutrition is. Again, I think that this is nothing new, but I think that sometimes people aren't realizing how important of a role nutrition plays in potentially causing your chronic back pain as well. And the easiest way to look at it is just to take this old cliche that you are what you eat. And the foods that you take in are essentially going to make up the cellular and physiological structures of your muscles and your joints and your tendons, your connective tissue and your bones as well. So if you have a diet that is very nutrient dense with a lot of vitamins or a lot of minerals or high in proteins and fibers, that's just going to give your body just way stronger, way higher quality building block materials to be able to create better quality cells that are going to essentially make up, your muscles, your bones, and your joints and whatnot. And if your tissue is very sparse in nutrition, or if you have a very, kind of empty calorie type of diet, just a lot of sugar, a lot of carbs, not high in nutrients, is obviously is going to give your body way less quality of, material to be able to work with. Just think of your body like a bridge. So if your bridge was made up of, sticks and twigs, compared to me if it was made up or of stone or concrete, which bridge is going to be way more robust, which one is going to be able to handle stress way better? Obviously the bridge that is going to be made up of stronger building materials. But it's not just the quality of the materials that I want to talk about today. I also want to talk about, certain, imbalances or certain, I guess incongruencies that people may have with certain foods. And this is something that I've had to learn the hard way over the past couple of years, having dealt with a very painful rheumatoid arthritis condition known as gout, where essentially my body is unable to process certain foods that are high in a content known as purines, which essentially leads to a buildup of uric acid crystals within my bloodstream, which then starts to form crystals, which then start to attack certain joints, such as my foot or sometimes in cases my big toe. And for anybody that's had gout or has known anybody that has gone through this, this is one of the worst physical pains that I think a human can possibly experience. And the point that I want to make is that this is a chemical problem due to foods. And there's no level of physical therapy that it can do in the form of stretching or exercise or strengthening to be able to fix a problem that is due to, nutritional problems, essentially. Right now, I know that we're doing a video about back pain. I'm talking about a potential foot condition, but the underlying principle here is that certain people just may have certain foods that their body just cannot process. And what may start to happen is your body will start to create a ton of inflammation or just send a bunch of, white blood cells to try to, kill off these foreign invaders that your body just, doesn't know what to deal with. And that could be what's causing just a ton of inflammation around your gut, or making your stomach very sensitive, or making you be bloated, or potentially just affecting the overall health of your back muscles or your tissues, just because of how much inflammation may be kind of happening within the area. Again, something that I'm not expert to, but something that I just feel is potentially the underlying cause for so many people. And just the simple fact that if part of somebody has poor nutrition, they're going to potentially be 15 to 20 pounds heavier than they should be. And just that 15 to 20 extra pounds are just kind of weighing down on your spine, weighing down on your back. That could be the thing that just kind of takes your back over the edge. And what was once a, 2 out of 3 kind of tolerable pain is now a 7 or 8 out of 10 pain. And it's just something that just cannot be dealt with. And the only thing that has changed is the fact that you've put on, extra weight that you probably shouldn't have. And I know that there are barriers and obstacles to be able to make better food choices. I understand the fact that, they put certain things in the foods that make them, very addicting, and people have certain cravings for things that are unhealthy. I know that for people that are under a lot of stress, sometimes they, find a lot of comfort in the foods that they eat, or people just develop certain habits around certain foods, and they just don't realize, how much this could be impacting their overall health. But if you are in a situation where you're in chronic pain and you can barely move the way that you want to do, if your quality of life is suffering, and if someone offered you a chance to be able to, make some little changes by making better food choices, or if somebody else is just going to give you a bunch of pills that are just going to allow you to just kind of live life the way that you have, obviously making the harder kind of temporary choice is going to be way better for your overall health than just taking a bunch of things that's going to mask your condition and be able to allow you to continue with behaviors that you probably know deep down you actually need to change. And the thing I really want to stress within this video is, I know I'm probably not saying anything that's new or revolutionary. It's just the fact that, we've just seen firsthand, just through observation, some people that are, they're doing the right stretches, they're doing the right exercises, they're doing everything physically correct, and they just make a couple of tweaks to their diet, and all of a sudden their pain goes away. For example, a woman that I've been working with, she just started taking magnesium, and all of a sudden a lot of the cramps or a lot of tightness within the muscles along her spine started to go away, and we just saw a significant improvement in her body's ability to move, significant, again, reduction in tightness, and her posture started to improve, her motion started to improve, just by being able to fix some of these chemical imbalances that we didn't even know that they were there. And the thing I really want to stress is that, again, not all problems are structural, not all problems are physical, and that problems that are due to nutrition is not coming from your disc, it's not coming from arthritis, it's not coming from, weak or torn muscles, but nutritional problems need nutritional solutions. And to make sure that you are aware of the fact that if you're someone who's doing everything right, and you just know there's this a giant elephant in the room in terms of you knowing that you need to make better health decisions in terms of your nutrition, then then that's the path that I would go down. And I would be, very shocked to see if that you don't see some form of significant change when you start to correct the thing that you know deep down you need to correct. Okay, so the last underlying root cause I want to talk about today involves a system that I would say is probably the most important system that people need to understand in terms of how big of a role this actually plays in terms of potentially causing your chronic pain. Because this is essentially the system in terms of where all your pain is actually going to be generated from. However, this is also the system that I find that most, spine specialists or orthopedic surgeons just seem to completely dismiss or overlook or underestimate or sometimes even laugh at the notion that this problems within the system could actually be the underlying root cause as to why somebody is in a chronic pain situation. And the system I'm referring to are problems within your nervous system. So the nervous system is just such a complex entity that I'm like even having like trouble finding words to even describe what it actually is or what it actually does. But the best way that I can describe it is the fact that it is a network of nerves, of nerve fibers that essentially run, from your brain, throughout your spinal cord, all throughout your body. And it is essentially a network of communication with how our bodies are able to communicate to our brain and how our brain is also able to communicate with our bodies. And that there are just so many complex systems within our body that allow us to essentially live and function as human beings on this earth, such as our kidneys, our heart, our liver, our lungs, obviously our musculoskeletal system as well. For example, whenever we want to try to move, our brain or our spinal cord is dictating the control of our muscles to allow us to be able to move and interact with our environments. But the thing that I believe that most people don't realize or sometimes take for granted is the fact that, all these systems are being run in the background at an automatic subconscious level to the point where, people can't be consciously aware or have to be able to consciously control all these various systems that are designed to be able to keep us alive and breathing. So imagine if you actually had to think about every single breath that you had to take throughout the course of the day to stay alive. Think about if you had to actively, consciously control and manage your heart rate or your heart rhythm, or being able to filter out all the toxins in like your liver, your kidneys. There's no way that you would have any ability to be able to think about anything else. And like any other system that exists in this universe, there can be problems with the system. Sometimes the system can break, and there are just issues that can develop with these systems within your body. And that what's going to happen is when there is a problem, our nervous system is going to deliver a signal of pain to warn and alert your consciousness that there is something potentially wrong with your body or with one of these systems, and that you should need to act accordingly to be able to fix this issue to make sure that you stay alive. So essentially what I'm trying to say is that pain is a good thing. It is a necessity. It is what allows us to be alert to the problems that are developing within the body. And this is why I'm so opposed to people just taking a bunch of pills or taking a bunch of painkillers, because all that really does is it just numbs those signals, and people can't actually be able to interpret what's accurately going on within their body. How we try to explain to our patients is that pain is very similar to a smoke alarm in your house or in your apartment. And if you are dead asleep in the middle of the night and your smoke alarm goes off, there's going to be a loud, obnoxious sound that interrupts you from your sleep. And it is going to be something that is very annoying, but it's there for a reason. Because if there's a fire ravaging in your house, that you better get out of there to make sure that you don't burn alive. And the reason why it's important to understand the difference between, nerve or nervous system problems from all the other systems is the fact that, for some people, the reason why they're actually in pain is because there is a problem with the nerves themselves, and that there actually is no, physical or physiological pain or injury. There is no inflammation. There is no arthritis, or there is no, physical reason as to why the person should be in pain, other than the fact that the nerves are just going off for no reason. This is very similar to if your smoke alarm went off, every time you just lit up your stove, or every time you try to just like light a little candle in your back room. That would be a very annoying and very obnoxious situation if your smoke alarm was just constantly going off in your house. And this is what I believe happens for people who have nervous system problems, is the fact that their brain is just being constantly bombarded with annoying pain signals when there's no actual physical reason as to why they actually are in pain. And these are signs and symptoms of what we would call an overactive or hyperactive nervous system, to the point where, again, it is overly sensitive to pain stimuli when it ordinarily wouldn't. Now, the most textbook example of this type of pain is for someone who experiences something known as phantom limb pain. So phantom limb pain occurs when there is somebody who is an amputee who actually still experiences pain in the arm that they no longer have. And we know that this is true because of the fact that when these people have, functional MRI brain scans, it actually shows that the pain centers of the brain actually start to light up when they say that they're experiencing pain in their arm that's no longer there. And the only reason why the person is obviously in pain is due to the fact that the nerve endings are what's giving off pain signals and is giving the perception of pain, even though there is obviously no physical or physiological reason as to why the person is in pain. And the reason why that this is important is due to the fact that if we actually want to help these people to get rid of their pain, we have to acknowledge the fact that they are experiencing pain in the area that's not there, and to be able to use a neurological toolbox to be able to help them desensitize their nerve endings or to help them rewire their brain in terms of how the brain is perceiving their body. And that's the only way that those signals will actually start to calm down. And I know that phantom limb pain is an extreme example, but I know that there are just so many other neurologically based pains that are out there that most people just are not being diagnosed with or just are not using the right set of tools to actually help them deal with these people. For example, for people who are under just so much psychological stress to the point where their muscles are always tight, to the point where their bodies are just being filled with stress hormones all the time, this is going to affect the perception of the brain and the body just due to the fact that the constant stress and all the cortisol that's flowing through the bloodstream is going to negatively impact the nerves. Or for people who are under just chronic inflammation, either due to dietary problems or just other systemic issues as well, just your nerves being flooded with constant and chronic inflammation can start to alter the state and potentially make your nerves way more hypersensitive to pain than otherwise would. Or for people who are going through things like PTSD or who have had, potentially, like psychological or physical traumas that are still just kind of manifesting themselves in the body. For example, we've seen people who have been taking care of, aging parents who are struggling with Alzheimer's, people who have lost loved ones over the past couple of years, people who have lost their jobs who have, just under so much, stress and so much, psychological trauma over the past couple of years. And these are people who appear very healthy. These are people who eat right, they exercise, they stretch, they take care of their bodies in every way possible, but their bodies are literally breaking down at the seams and they have no idea why. And the big elephant in the room is the fact that they have, some of these, psychological stress issues that are just eating them away. And no one is acknowledging the fact that some of these psychological, neurologically based traumas or could actually be causing their pain, could actually be causing their symptoms. And the reason why it's important to understand that this could be the root of your issue is, again, because of the fact that there are neurological based tools that are out there that could help you deal with some of these issues. Simple tools such as, breathing or meditation are very simple and short ways to be able to help you, calm down your nervous system when you are tense and when you are under, a tremendous amount of anxiety. Or if you have, chronic inflammatory conditions due to, poor diet, like we talked about in the previous section, this could actually be causing your nerves to be hypersensitive and giving your brain signals when it ordinarily wouldn't. Or if you are someone who is dealing with some of these other psychological issues, then it's okay to be able to see someone like a psychologist to help you work through some of these things. And that the most important takeaway of all this is to help you understand that, if you're taking just a bunch of pills or even being told that your back pain is coming from, a degenerated disc or a pinched nerve that's going to require surgery, but if your pain is actually due to issues with your nervous system, then obviously those things are never going to fix or solve your problem. So that's it for today's video, where we've gone over, 5 potential other explanations or root causes for your chronic back pain that I just feel that most doctors are just not having these types of conversations with their patients nowadays. And that the main message that I want to get across is that there are different solutions that are out there for you that do not come in the form of a pill. They do not come in the form of having multiple injections kind of rammed into your spine. And it does not come in the form of having back surgery when it is completely unnecessary. And there's no, physiological reason as to why somebody should actually have back surgery in some cases. And the last thing I want to say, and I've said this before and I'll say it again, that when we can actually spend some time to be able to figure out what the problems actually are, and for a lot of people, it can sometimes be a combination of all the things that we said, but when we can then match the correct solution on top of the right problems, that's when the magic starts to happen. And that's what we've just seen with our own two eyes over the past several years, when people have been able to significantly reduce their pain, significantly increase their overall mobility, and just improve their quality of lives at a level that most people just wouldn't have ever been able to, even dreamt of before, just because of the fact that we've been able to reduce or eliminate the actual problems that are going on within a person's lives. And the last message I want to say is that, just don't give up. Again, there are solutions that are out there for you, but more importantly, you have to be able to find somebody who can actually listen and actually help you figure out what the underlying problems actually are. And if you know deep down that there is something that's just eating at you, or deep down that there's something in your life that you need to change, and nobody has been able to validate that that's actually causing your pain, then you know what, it probably is causing your pain. And just try to find somebody who can help you, match the right solution on top of what those problems actually are. So that's it for today's video. I hope that this helps, and I hope to see you again next time. Take care, everybody, and have a wonderful day.